Hi, this talk will cover Creutzfeld-Jacob disease and some of the clinical pathological features of this interesting but kind of scary disease. Creutzfeld-Jacob disease is part of a group of entities known as spongiform encephalopathies. The transmissible spongiform encephalopathies, or prion diseases, are a group of neurodegenerative uniformly fatal disorders of humans and animals. The human prototype for these entities is Creutzfeld-Jacob disease. Common to all of these diseases is the accumulation of an abnormally aggregated and protease-resistant form of the mammalian prion protein, PRP. The misfolded form of this protein can seed a progressive conversion of normal protein. Most cases are sporadic, although familial and iatrogenic examples are well recognized. The susceptibility to and clinical characteristics of all forms of the disease in humans are influenced by a polymorphism at codon 129 of the gene encoding the prion protein, the PRNP gene, located on the short arm of chromosome 20. The typical clinical course is that of a rapidly progressive dementia, and this separates it from the other entities that we've talked about, which are chronically progressive. Other common symptoms include myoclonus, particularly startle myoclonus, visual or cerebellar disturbances, pyramidal dysfunction, and akinetic mutism. The diagnosis is supported by characteristic EEG changes, as well as elevated levels of protein 14-3-3. Most cases are sporadic and occur in patients between 50 and 70 years of age. Approximately 10% to 15% of cases are familial, with an autosomal dominant pattern of inheritance. These cases are due to mutations, deletions, or insertions in the PRNP gene. Iatrogenic transmission is well documented in the literature and may occur via any of these mechanisms listed below. Grossly, there is little to distinguish the spongiform encephalopathies from other neurodegenerative disorders. Brains from these patients are either grossly normal or exhibit mild diffuse atrophy, likely because of the rapid onset of symptomatic disease doesn't allow for more severe atrophy or grossly recognizable changes. The spongiform encephalopathies are characterized by the histologic triad of neuronal loss, gliosis, and spongiform change, which we'll see in the next slide. Amyloid plaques, referred to as Kuru plaques, are found in about 10% of cases of sporadic CJD. The spongiform change should be obvious from this slide in that the brain parenchyma has this Swiss cheese or sponge-like appearance. Again, in the background of this is neuronal loss, which is more easily seen with immunohistochemical stains to neurons, as well as gliosis or scarring. Finally, we can see these deposits known as Kuru plaques. These are amyloid plaques that are seen in a minority of CJD patients and is recognized here in the cerebellum. So that's it for CJD and spongiform encephalopathies. Thanks.